Assalamualaikum warahmatullahi wabarakatuh. I am Noraleya Sufia binti Mohamad Nassir from DA27330D and my matrix number is 2024 for 32002. Today, I'll be talking about the skills shortage in Malaysia's healthcare sector, which we're addressing the shortage of the qualified professionals. First of all, when we mention about the skills shortage in Malaysia's healthcare, most people will think of the doctors and the nurses. But in this video, I will mention about the other role of healthcare sector that actually as important as the doctors. To start with, Malaysia's Ministry of Health is the one who builds the hospitals and the clinics. But at the same time, human resources like the healthcare professionals must also grow alongside to ensure that Malaysia's public healthcare remains sustainable. Unfortunately, the public sector handles most of the workload, which is at least 64%, such as the hospital admission, the outpatient visit, deliveries, and also most cases of COVID-19 hospitalizations back in 2020. Focusing on COVID-19, the local healthcare system faced a huge pressure due to the pandemic and the demand for the healthcare workers rose dramatically. But unfortunately, they did not get to meet the ends since there were not enough trained healthcare professionals. By this, they had to depend on their existing in-house expertise to survive the pandemic. This ratio of public and private sector becomes unbalanced since more skilled personnel often work for private sector. Ideally, 70% healthcare workers should be working in the public sector since it has much heavier workload. Besides the general doctors, more specialists such as the oncologists, radiologists and pharmacists will also needed to work in public sector by 2030. And by the way, I will also discuss about these specialists on the issue. Back to the doctor, by seeing these unstable numbers of the specialists needed, this tells that how many these specialists are needed in the future to work in public healthcare. Moving on to the next, I will talk about the shortage of other role, which is the nurse. Malaysia has been struggling with this shortage since in 2000s. This condition has been worsened because most of them leaving the public sector and seeking opportunities abroad, which offers them better benefit. For example, Singapore offers salaries that is nearly double compared to Malaysia, has career growth and also has housing allowances. Besides that, other countries such as Saudi Arabia and Dubai also tax-free and could earn more compared to Malaysia. To discuss about the factors, it could be that the local hospitals are frequently overcrowded, which force them to work long hours without adequate compensation or rest. Even though there is the 45-hour work per week, it does not reduce the pressure on the nurse as there has a serious issue in understaffing. Sadly, the number of vacancies has increased from 2,000 to 6,000 comparing the year 2020 and 2023. Based on my research, government must intervene in this issue to prevent it from getting worse. Some solutions that can be taken is offering competitive salaries that reflect the rising cost of living, give additional benefits and pay for their overtime. Next, the hospitals should invest on infrastructure such as modern medical equipment to reduce the burden on the nurses. Moving on, I will talk about the oncologist shortage and shaping healthcare innovations for a healthier future. For additional information, oncologist is someone who is specialized in cancer disease treatment, or we call it a cancer doctor. The oncologist in Malaysia is currently facing shortage, which it only has 120 oncologists for over 30 million of people, which can lead to delay in treatment. And what more concerning is, death caused by the cancer is increasing from 12.6% in 2022 to 13.8% in 2023. This means that the cancer patient is increasing followed by year. And because of this shortage, rural areas face greater challenge in accessing oncology service compared to the urban areas. The next specialist shortage is radiologists. Radiologist is a medical doctor who specializes in diagnosing and treating conditions and injuries using imaging equipment, for example CT, which stands for computed tomography. In Malaysia, we have around 870 radiologists registered, with 80% of the service provided by private sector. Since the professionals are low in quantity, The accuracy of plain radiographic interpretations by Chinese and non-radiologists is quite concerning, with overall rate of accuracy 69%. By the situation, it raises question about the reliability of diagnosis made by less experienced personnel. And to overcome this shortage of radiologists, ongoing effort is a must in training more radiologists to ensure equitable healthcare services. Next, the last profession that I will talk about is the pharmacist. Even though most people think that the profession is the most simple one, just giving out medication, they actually play a big role in helping out the society. They are the first contact for people needing medical. Hence, it makes them a critical role in healthcare alongside the doctors. But unfortunately, pharmacists often feel undervalued and overworked. For the factors of them facing shortage can be the same reason as the nurse, which is lack of career opportunities, low salaries, and poor work-life balance. By these factors, most of them either quit, change career, or migrate for better working conditions. But there are ways to retain these valuable professionals. The department can improve their work-life balance by reducing the working hours, ensure enough rest days, and manage the workload more fairly. Besides that, they also can allow pharmacists to move up in their careers and provide better salaries and benefits to reflect their level of contribution. Last but not least, behind this issue of shortage in healthcare sector, the government actually has been urged to listen to healthcare workers' experience to provide solution. Code Blue, which is a website that reports on issues that related around the world, including Malaysia, citing a survey for the doctors regarding their concern. Based on their survey, most of them had considered to resign, felt that their salary is not worth their workload, overworked, and also uncertain about their career growth. Next, there is an unequal distribution of doctors between urban and rural areas, as well as the eastern and western region of the state. To overcome this, one of the ways that the government did was sending students abroad to study medical degrees and expanded local medical programs. But unfortunately, once they returned, there were not enough placement for housemanship training, nor sufficient medical senior staff to mentor them. As a result, there was a surplus of doctors with no permanent position, which led to the contract-based employment. Mainly, the focus to improve should be on equitable distribution and not merely increasing numbers of the doctor. As for the posting healthcare staff to rural areas, the condition of the rural areas such as the roads, water, internet and facilities could be one of the reasons to discourage them from working there. And by that, they should also improve those infrastructures before posting the staff to work there. And that's all for the discussion regarding the healthcare system in Malaysia from me. Thank you.